Welcome to the video abstract of my article, which recently has been accepted for publication in Equine Veterinary Education. The article entitled is Standing Computed Tomography of the Equine Limb Using Multi-Slice Helical Scanner Technique and Feasibility Study. By the way, I am M Mageed. I'm working as a radiologist at Technical Germany. The first documented clinical trial using a CT as a scanning modality in equine distal limb in standing fashion dated back to 2008, where a French group using a peripheral quantitative CT scanner in 47 clinical cases. Interestingly, 90 seconds were the acquisition time per slice. Not surprisingly, 11% of the slices were invalid due to the motion artifact. The current article aimed to provide technical setup and feasibility of using a multi-slice helical CT unit, which introduced recently in the equine market. For that purpose, the medical record of a horse is admitted at technical conclusion for standing limb CT in the period between March 2019 and January 2020 have been reviewed. A special attention has been drawn to the image anatomical region and the number of the scan attempts. Thereafter, the image quality has been assessed by a single observer using 3-point visual grading system. The grade 1 represented no limitation for clinical use. That means the images are free from the motion artifact, where grade 3 means the images have poor quality due to the severe motion artifact, and the image must be revisited. Shortly, the CT unit contains of a sliding gantry CT with a gantry opening of 90 centimeters, and this gantry built on a platform. This platform enables bringing the isocenter of the gantry at the level of the anatomical intercept region. For instance, this image represents a setup of scanning the distal fetlock in the front limb. For more illustration, this horse aimed to scan the carpus. The horse positioned in an angle of 45 degrees to the gantry, and the horse support with a metallic support attached to the frame of the gantry, or of the CT unit. And when the gantry is sliding away, there's a risk the horse is sliding with the gantry. Therefore, we have a rope preventing or holding the horse in place when the gantry is sliding away from the patient. As you can see, the image quality graded as 1 at the carpus area. In spite, there is a slightly motion artifact at the distal third metacarpal region. For the hind limb, the horse positioned at the angle of 90 degrees, and the region of interest positioned at this isocenter and supported with the rope. In this setup, it must be a person holding the horse head during the scan. So generally, we have a 32 patient met the inclusion criteria, and 3 horses have been excluded because they're used for training purposes. The majority of the horses underwent a CT due to lameness history, and the majority of the scanned limb were a front limb. The half of the patient got a contrast-assisted CT, and the anatomical region of interest were 14 feet and 13 fetlock region, regardless of the front or hind limbs, and 2 proximal suspensory ligament, 2 carpus, and 1 tarsus. However, 94 scan attempts has been recorded for the whole 32 patients with a range from 1 to 7 scans per horse, with a mean of 3 scans per patient. The diagnosis based on the CT was space occupying mass, chondropathy, fissure fracture, subchondral bone, cyst, osteoarthritis, and sesamoiditis. More interestingly, 29 horses got an image quality graded as 1, where grade 2 has been recorded only in 2 horses and grade 3 in 1 horses. And the motion artifact was the cause of reduced image quality in the most of the images. Here we have an example of a horse who got an arthrography or contrast-assisted arthrography. It's so obviously there is a full thickness cartilage erosion in the distal interphalangeal joint. But more interestingly, this horse got an standing MRI, and this lesion could be questionable in standing MRI. So in summary, The feet and the fetlock reading can be easily imaged, and imaging of the proximal anatomical region of the limb is achievable. Thank you very much, and for more details, you will find that in the article.